Hi, my name is Angie Sanchez, and I am the head of programs for Corazon Healdsburg. For those of you who don't know Corazon, we are a nonprofit organization working to strengthen the Northern Sonoma County community by bridging the racial, cultural, and economic divide that exists today. And I'm so happy to be here with you, Sue. Thank you so much for the invitation. And I am looking forward to our plática, our conversation.
Wonderful. Thank you, Angie. My name is Sue Labbe. I am the medical director at Alliance Medical Center. We are a federally qualified healthcare center serving the community of Northern Sonoma County.
Great. So we are here today to discuss what is happening during this pandemic in our community and what resources are available in the healthcare sector for those families that Corazon serves, that are living in the community, Healdsburg residents. And so I guess let's just start with having a conversation on sharing with us what type of pediatric care is available during this COVID-19 crisis.
Absolutely. So it is really important for the community to know that during this crisis, Alliance is still here to support your needs for our pediatric patients, for all of our patients. And we have changed some of the way that we're practicing medicine during this time to make sure that we're maintaining the safety of our patients. And so for our pediatric patients, many of our sick child visits are being conducted in a new way now by using telephone or video platforms to make sure that people don't unnecessarily need to leave their homes or put themselves at any kind of risk in doing so. But if after being seen in this manner by your medical provider, the provider determines that an in-person visit is both safe and necessary, they'll coordinate that with the patient. So care is available and we will make sure that you get the care that you need. We are also continuing to see our newborn and very young patients as it's really important to monitor them closely in the first couple weeks of life. And a lot of that care really does require in-person visits, which we take lots of precautions to make sure that people stay safe during that time. One thing that we really want to make sure people are doing during this pandemic is staying up to date on their immunizations. And so all of our patients, and specifically our pediatric patients who are needing immunizations, are definitely encouraged to come to clinic to receive those immunizations. And so, you know, although we're all sitting here waiting anxiously for the availability of a vaccine to protect us against COVID-19, unfortunately, one's not available yet. But it's really important to remember that there are many contagious diseases for which there is a vaccine available. And so it's our current responsibility as a community health center to make sure that we educate our patients about the vaccines that are available to them, as well as the diseases that they prevent, and to make sure that they have access to these tools of protection. You know, in our country, since COVID started, vaccine rates have declined drastically, and that's really concerning because the last thing our country needs or our community needs is an outbreak of a preventable disease on top of COVID, as that could be really devastating. So we just really want to get the message out to the community that if you are needing vaccines, we can ensure your safety, and we want to make sure that you come to us and get those vaccines to protect yourself and your family and our community.
Mm-hmm. I know that when my daughter started 7th grade, there was a vaccine that was required to begin the 7th grade, or you could not attend school in person. So we want to remind those that although you are going to be at home and the children are going to begin the school year online, it is still so important for you to reach out to your providers to continue to get those vaccinations. Like you mentioned, Sue, it's a way to prevent a disease or an illness that could be, you know, that won't move on further if you're able to get the vaccination.
Absolutely. So the vaccine that you're referring to that's required for 7th grade is a vaccine to prevent a disease called pertussis. And pertussis is alive and well in the United States, unfortunately. We've had over the last several years, several pocketed outbreaks of pertussis in individuals that had not been vaccinated for it. And in pediatric patients, especially very young pediatric patients, or those who have kind of frail immune systems for other reasons, pertussis can be devastating and in fact can be deadly. And so when, little ones get pertussis, if they're not vaccinated, they oftentimes will end up in the ICU, may end up on a ventilator. So although we don't hear about these as often because we have vaccines to prevent them, an outbreak could be really serious and it could be devastating to our community. So absolutely, really important that people stay on top of their vaccines during this time.
Yes, get vaccinated. Get your children vaccinated. It's so important. Let's continue to prevent, spread of more illnesses, and let's, work together to stay healthy. So you've shared a little bit of what the pediatric care is available during COVID-19 crisis. Can you share with us what services or testing and follow-up is available for those who are interested in getting tested for COVID-19 or have gotten or received a positive test, and then what sort of follow-up is being provided on behalf of Alliance Medical Center?
Absolutely. This is really a fluid situation and has certainly changed dramatically since the onset of COVID-19, both with the availability of testing, with the supplies necessary to do the testing, with the turnaround time as far as how quickly labs can process testing. Currently, as of today, there is a significant delay in getting testing results, which is really frustrating to patients. It's really frustrating to the community. It's really frustrating to myself as a medical provider. And we've been working with the county and we've been working with the local government and trying to increase access to testing or capacity for testing so that people can get results quicker. Here at Alliance, we do offer our patients testing for COVID-19. It is done based on a triage system. So what that means is that the patient calling in with concerns that they may have been exposed or concerns that they may be having symptoms, or maybe their provider has identified that their symptoms might be related to a COVID illness, will speak with one of our nurses. And all of our nurses are bilingual, bicultural, definitely want to be able to provide patients with that information in their preferred language. And so we will get some additional information about, what the concerns are and identify when would be the most appropriate time for them to get tested based on that information, or if testing is indicated. And if testing is indicated, we are currently doing that in our parking lot. So we have a drive-up area where a patient would actually remain in their car, and our nursing team would meet them outside and do that testing in their car. And then if there's additional information or follow-up that's needed, we would call them on the phone to do that, because we really want to minimize kind of that exposure, both for the patient and for our staff.
Great. I think for the community who is watching this video, it might be helpful to have a couple examples or some of the questions that we at Corazon have come across are, what if somebody has been exposed to somebody who has tested positive in a household or at their work? Is there a waiting period for them to get tested if they do not have symptoms, or can they call and request to make an appointment to get tested?
Yeah, I think this is one of the areas that's been the most frustrating for folks and the most difficult for people to understand, because there's a lot of fear. If you find out you've been exposed to COVID, you want to know right away if you have it. And we as a health center have to follow what the state and local health departments are advising as far as when we test patients based on kind of the clinical scenario of what's going on with them. Unfortunately, for patients who are not experiencing symptoms, who were just recently exposed, we are very likely to get what we call false negative results. And what that means is that they may have been exposed to the virus, they may be likely to develop the virus. However, there's not enough of the virus in their system at that time where we can detect it by the test that we currently have available. And so the fear of testing somebody too early is that we give them false information, because it comes back negative, when in fact, had we have waited long enough to be able to detect the virus, we would get more useful clinical information. Right now, there is such a backlog in the turnaround time in order to get testing results that it's really creating a problem for our community. Because if we are asking someone to wait for a period of time, which right now the recommendation is to have individuals wait 12 days, which is a long time to wait, after the time of exposure, if they're not having any symptoms. And then on top of that, then they have to wait for results to come back, sometimes up to 14 days to get those results, which is, I'll just be totally honest, unacceptable. I mean, we need to do better as a community and as a county, and we need to get those results back to patients in a much more expedited fashion. But a lot of that just comes with, this is a new thing that we're dealing with, and we don't have the infrastructure to support it. And I know our county officials are working on it, and our labs are working on it, but it's got to happen, and it's got to happen soon.
Yeah. And what can you share with me in regards to confidentiality? I know that there's questions around who is this information being shared with. There's a fear of getting tested, with the fear of maybe that their information is going to be shared with ICE, immigration, or is this information about their testing, whether they went to get tested or not, whether it's positive or negative, is this being shared with their employer? I've even had somebody ask me, if I live in an apartment complex, does this information get shared with the property manager or owner?
Mm-hmm. So at Alliance, as a healthcare center, we follow strict what's called HIPAA guidelines, and that's basically Privacy Act guidelines that require us to maintain the confidentiality of patients' medical information. There are some exceptions to that, and what that means is there's certain reportable diseases that we do need to notify the health department if somebody has them, and that's for a public health safety reason. We are not required to notify their employer or their apartment complex manager, but we are required to notify the public health department. We absolutely have no relationship with ICE whatsoever. We would never report that information to immigration services. And it's really, really important to us that all members of our community feel safe coming to Alliance and receiving care here, regardless of their citizenship status. We are a safe place for people to come, and we would never share that information with any kind of immigration agency.
That's great. That's great to hear. Okay. And for somebody how can somebody receive any of these services?
So we are a primary care medical home. And so what that means is we really want to take care of the whole patient. And so we want to make sure that people that come to us for care are getting access to all the services that we provide, both behavioral health and subspecialty and primary care, and even our dental services. We want to take care of that whole person. And so we do offer testing services to our patients. We also offer testing services to patients who are individuals within the community that are looking to establish care with a primary care medical home. And part of that is that if a patient were to test positive for COVID-19, they need medical follow-up. We need our staff following up with that patient to make sure that they're safe, to make sure that they have the resources that they need, and that if their symptoms progress to the point where we need them to get a higher level of care, we need to be managing that. And so it's really important to us not to just give people results and send them off into the community without any kind of support and assistance during that process.
Exactly. And so what type of insurance, or is there a sliding fee scale?
Mm-hmm. Absolutely. So we provide care to patients regardless of their ability to pay. We are here to provide the care that the community needs. We do offer a sliding fee scale for patients who are uninsured. We are not charging for COVID-19 testing at all. And so even for our uninsured patient population, if it's determined that they need to be tested, we will do that testing free of charge. We do not even collect a sliding scale fee for that. We just want to make sure that there are no barriers to people receiving testing. For our patients who are covered under Medi-Cal, testing for COVID is a covered benefit, so there would be no out-of-pocket expense for that as well. So we absolutely do not want to make any kind of financial barrier to people getting that access to care and that access to the testing they need.
Great. Can you share with us what is the phone number that one needs to call for the pediatric care? And then is there a separate phone number that is specific to the COVID-19 testing and or services?
Yes, so for our regular main number, it's 707-433-5494. That's our main clinic number. We do have a specific phone number to call for COVID-19 triage. I'm going to be honest, I don't have that number in front of me right at the moment, but when they call the main number, there's actually a recording that gives them that number, so they can always call that number. It's also posted at all of our entrances to all of our sites as well.
Great. And then you mentioned that you have bilingual, bicultural staff members, and that's great, as you know, you're providing language access for not, you know, just English-speaking families and individuals. Is there also another way for community members to get any other information or resources? Is it on your social media? Is it website, YouTube?
So there's definitely information available through the county website on the Sonoma County Department of Health website. We also have resources information on our website. There's a link that patients can click on. There's some general information, and then there's some additional resources. We also are trying, when we reach out to our patients or when patients come into testing, we're trying to evaluate what resources they might need to be able to safely quarantine or isolate at home and keep them and their families and our community safe. And so hopefully it's a partnership with our patients where they can feel safe with us to let us know if there's resources they need, and then we can advocate for them to make sure that we get them those resources and support them during this very difficult time.
That's great. Thank you, Sue. Is there anything else that you would like to share in this video?
Yeah, especially for our patients who have access care through Alliance in the past, I just want to let people know that things may look a little different when they come back to get care if they're coming back on site. Over the last 4 months, we've dramatically changed how we are providing care to our patients. As I mentioned previously, we've begun offering visits over the telephone and through a video platform, so a lot of our patients haven't come on site since the onset of the COVID crisis. For those patients who do need to be seen in clinic, they will be screened for symptoms both over the phone, and then when they come in person, we have a table set out outside of all of our facilities where they will be stopped. They'll be asked a series of questions. They'll have their temperature taken just to make sure that everybody enter the building is safe to do so. We're actually doing the same thing for our staff. So you'll see the staff getting their temperature taken potentially, depending on what time your appointment is, because we want to just maintain safety. Once they are entering the building, everybody's being asked to wear a mask. So you'll see our staff walking around with masks on, our patients walking around with masks or face coverings on. If patients come to clinic and they don't have a face covering, we will be providing them with one before they come into clinic. So that's something that we require for everybody. Once they do come into clinic, they will see that we've made a lot of modifications. And so we have signage instructing them to maintain social distancing and practice hand hygiene. We have hand hygiene stations set up around clinic for patients to use. We have also set up plexiglass barriers at our pharmacy windows and our reception desk. So there's kind of a plastic in between you and the person that you're speaking with to protect people on both sides. We also, in all of our high-touch clinic surfaces. We are disinfecting hourly while clinic is open, and then the whole facility is deep clean nightly. So people will be, if they are here, they'll see people going around wiping down door handles and counters, and it's just kind of a continuous thing that's going on all throughout the day. And that's just because we want to make sure we're doing everything we can on our side to keep everybody as safe as possible. But it will look a little different. People who haven't been here in a while will be a little surprised to see how things look.
No, it is a transition that we all are going to go through and are going through. But I think it's great that Alliance is taking these precautions to keep the patient safe. But I also want to remind everyone that it's also our duty to help with some of those precautions. We need to be precautious. We need to social distance. We need to wear our masks. We need to wash our hands frequently. And so those are the things that we can also do. That's our part. And I think we just need to keep reminding ourselves of that and reminding those around us. This is a pandemic, and we, need to take this serious and be really careful for not only for ourselves, but our neighbors, our family members, our loved ones. And so if you do feel like you are, are ill and would like to get tested or would like more information, contact your healthcare provider, contact Alliance. Feel free to call Corazon Healdsburg if you would like more information, or if you are in need of a mask. We're all here to support you and provide the resources that you and your family might need. But yeah, I mean, we thank you for watching this video. This is just one of a few that we are providing during the virtual health fair. Check out the rest of the videos. There's some great information out there, and it'll give you an opportunity to meet your service providers or your healthcare provider and these med talks. So yeah, is there anything else, Sue, that you would like to chime in on or include?
No, you made some excellent points, Angie. So thank you so much. We've proven in this community that we're amazingly resilient over the last few years. We've banded together through some really harrowing times with the fires and with the evacuation last year. And we're being challenged once again. So it's important that we band together and support each other and practice social distancing and wash your hands and wear your masks and keep our community safe.
Yes. Keep yourself safe during COVID. Prepare. We never know when the next natural disaster will happen. And also get counted in the census, because we know that in order for us to get more resources and resources for the health center and the hospital and our schools, we need to get counted and say that, show that we are here, show that we need these resources and we deserve these resources. So if you need help with any of those things, information on emergency preparedness, need assistance filling out your census, reach out to Corazon. We are here for you. But yeah, thank you so much, Sue, for this invitation. This was a great beginning conversation on what you're all providing and the amazing work that your staff and you are providing for the community. And we thank you and all the essential workers during this very, very difficult time. And yeah.
Well, thank you so much. I hope everybody has a wonderful day.